Assalamu alaikum doctors. Let's talk about today and types of contraceptive methods. So before discussing types of contraceptive methods, first let's understand the term contraception. So contraception, it is also called as birth control, it is also known as fertility control, also it is referred as a anti-conception. So contraception is also called birth control or fertility control. Now, how you will define contraception? So, it is a method or device used to prevent pregnancy. So it is simple. What is contraception? It is a method or device used to prevent pregnancy. So actually in contraception we postpone the pregnancy. Now there is a special term which you should know about that is called as per index. So what is per index? Actually it is used to assess the effectiveness of contraceptive device. So when I say it is used to assess the effectiveness of contraceptive device, then I mean to say that it can also show the failure rate of contraceptive device as well. So if it show the effectiveness of contraceptive device, so we can say it also helps, it also show failure rate of contraceptive device. So per index, it is used to assess the effectiveness of contraceptive device plus it also show the failure rate of contraceptive device. So how you will calculate the per index? You can easily calculate the per index by taking a ratio, that is a total number of accidental pregnancies divided by total month of exposure multiplied by 1200. So the per index can be easily calculated by taking a ratio of total number of accidental pregnancies divided by total month of exposure multiplied by 1200. Now, which is the most effective contraceptive device? So that is a question. Which is the most effective? Which is most effective contraceptive methods? So the most effective contraceptive method, that is a oral contraceptive pills followed by intrauterine contraceptive devices, and then there is male condoms and female condoms. So don't forget the point. The most effective contraceptive pills, that is oral contraceptive pills followed by intrauterine contraceptive devices, male condoms and female condoms. Now, what is the failure rate of oral contraceptive pills? So the failure rate of oral contraceptive pills, that is from 0.1 to 0.5%. And what is the failure rate of intrauterine contraceptive devices? That is from 0.5 to 2%. And for the male condoms, that is 2 to 14%, while for the female condoms, that is for 5 to 21%. So by seeing the failure rate of these contraceptive methods, we can say the most effective contraceptive method is oral contraceptive pills, and the least effective contraceptive pills are female condoms. So this is a general overview that what is contraception and what are per index and which is the most effective contraceptive method. Now let's discuss the main types of contraceptive methods. So what are the types of contraceptive methods? So there are two types of contraceptive methods, that is a temporary method and there is a permanent method. So the types of contraceptive methods, it is divided into two methods, that is a temporary method of contraception, and there is permanent method of contraception. Now, temporary method of contraception, it is also called as spacing, while permanent method, it is also called as sterilization. So, actually, and we use this method when we don't need pregnancy. So, but the moment when we remove the temporary method of contraceptive devices, the pregnancy can achieve again in the temporary method. But on another hand, if we talk about permanent methods, here the pregnancy cannot achieve again once the contraceptive device is used. So this is that's why it is called as permanent method. So in temporary method, the moment we remove the temporary contraceptive devices, the pregnancy can be attained again. But in permanent method, there will be no pregnancy after using a contraceptive device. Now, there are certain subtypes of these methods. Now, what are the subtypes of temporary method? So, what are the subtypes of temporary method? The first one is that is called as barrier method. Now, the second type is intrauterine contraceptive devices, while the third is hormonal methods, and fourth is natural methods. Now, which is the most common temporary method of contraception? So, the hormonal method, it is the most common temporary method of contraception, while the second most common temporary method of contraception, that is a IUCD. So it is the second most common type, while the first is more common, that is a hormonal method. So out of hormonal method, there are various subtypes of hormonal method, but in the oral contraceptive phase, it is considered as the most common type, where we will be discussing it later, but till now just recall it that the most common temporary method is hormonal method, the second most common is intrauterine contraceptive devices. While moving toward the permanent method of contraception, it is divided into two types. There is male sterilization, and there is a male sterilization which is a vasectomy, and there is female sterilization, that is a tubal ligation. So I repeat, the contraceptive method is divided into two parts, temporary method and permanent method. The temporary method consists of barrier method, IUCD, hormonal method and natural method, while the permanent method consists of vasectomy in male, while tubal ligation in the female. What are the characteristics of ideal contraceptive devices? What are the characteristics of ideal contraceptive devices? So the certain characteristics are that it should be safe, non-expensive, easily available, and easy to use, widely acceptable, and require minimum need of monitoring, and it should be free from certain side effects, free of side effects. So it is important. What are the characteristics of ideal contraceptive devices? The ideal contraceptive devices, it should be safe, it should be non-expensive, easily available, easy to use, widely acceptable, and requiring speed of monitoring, and it should be free from side effects, or there would be these side effects. So these are the characteristics of ideal contraceptive device. So till now we discussed the types of contraceptive methods and general overview. Now here we will be discussing each method of contraception a bit detail. Now first we will be discussing the barrier method of contraception. Now let's discuss the first type of temporary method of contraception, which is referred as a barrier method. Now let's talk about the barrier method. Now the first type is that is called as barrier method. Now it inhibits the fusion of sperm and ovum, and thus it prevents the pregnancy, and actually it prevents the sexual transmitted diseases. So it is the one type of contraceptive method which is used to prevent the sexually transmitted diseases. Now the barrier method, it is divided into certain other groups. That is a physical method. It consists of physical methods. It is divided into chemical methods, and there is combined methods. Now barrier method divided into physical methods, chemical methods, and combined methods. So in physical method, it consists of male condoms, it consists of female condoms, it consists of diaphragm, it consists of vaginal sponges and cervical caps. So the physical methods consist of the male condoms, it consists of female condoms, diaphragm, vaginal sponges, and cervical caps. So what is the advantage of male condoms? It prevents the sexually transmitted diseases. Also it decreases the risk of cervical carcinoma in the female. While what is the advantage of female condoms? It also prevents the sexually transmitted diseases. Also it can be used by female during menstruation, plus it can be used during the excessive vaginal discharge. While the important point regarding diaphragm is that diaphragm, it is also called as Dutch cap. It is also called as Dutch cap, and it mechanically prevent the ascent of sperm up to the upper genital tract. Now another important point is that it is considered as one of the best contraception for patient with a heart failure. So don't forget this point. It is regarded as a best contraception for patient with heart failure. So diaphragm is also known as Dutch cap. It mechanically prevents the ascent of sperm up to the upper genital tract, and it is considered as one of the best contraception for patient with a heart failure. So these are all coming under the category of physical method of barrier method. Now what are the chemical methods? There are certain things that are coming under chemical methods. Consist of foam tablets, spermicidal jelly, creams, and suppositories. So the chemical method, it consists of foam tablets, spermicidal jelly, creams, and suppositories. Now the important point is what are the drug that is used in a chemical method. So the drug that is used in chemical method, that is a non-oxynol 9. So please don't forget this. That is a non-oxynol 9. The drug that is used in chemical method, that is a non-oxynol 9. So it is important. Now the combined method, it is the combination of physical method plus chemical method, and it consists of condoms and creams, jellies, etc. So it is a combination of physical method and chemical method. So I repeat, the barrier method divided into the three subtypes, that is a physical method, chemical method and combined method. And a physical method it consists of male condoms, female condoms, diaphragms, vaginal sponges and cervical caps, while chemical method consists of foam tablets, spermicidal jelly, creams and suppositories, and the drug that is used in chemical method as a surfactant, that is a nonoxynol 9. It is important for MCQ. And the combined method consists of the combination of physical method and chemical method in the form of condoms and jelly. So this is what we need to know about the barrier method of contraception. So let's talk about another method of contraception, that is called as IUCD, which is called intrauterine contraceptive devices. Now, as I told you earlier, the intrauterine contraceptive devices, it is the second most common temporary method of contraception. So let's discuss the IUCD, which is called intrauterine contraceptive devices. So it is the second most common type of contraception, and actually this IUCD, it is the second most common type of contraception, while the most common type of temporary method of contraception, that is oral contraceptive pills, the second most common is IUCD. Now these IUCD, it is inserted by doctors or expert nurses into the female uterus through the vagina. Now what are the indications of IUCD? What are indications of IUCD? So the first is, if female can't tolerate the hormonal contraceptive, if female can't tolerate hormonal contraceptive. The second is, if estrogen is contraindicated. And the third is during lactational period, like during breastfeeding in the women. So the indications are, if female can't tolerate hormonal contraceptive, then you will go toward the IUCD, and if estrogen is contraindicated, and if there is lactational period. Now what are the types of IUCD? What are the types of intrauterine contraceptive devices? So the types of intrauterine contraceptive devices, it is divided into two broad categories, that is a non-medicated IUCD, that is non-medicated IUCD, and that is a medicated IUCD. So non-medicated IUCD, it consists of first generation IUCD. It consists of the first generation IUCD. Now in first generation IUCD, it consists of the famous example under non-medicated IUCD, it consists of lipus loop. So it is made of plastic or steels, usually it is made of plastic impregnated with the barium sulfate. So the important example under non-medicated IUCD is lipus loop. While on another hand, the medicated IUCD consists of the second generation IUCD and third generation IUCD. That is second generation IUCD and third generation IUCD. Now, what are the examples under the second generation IUCDs? So it consists of copper T, copper Noah. It consists of copper T, copper Noah, and multi-load copper T, multi-load copper T. So the name is given according to the shape and size. So in copper T, the amount of copper is relatively less as compared to the multi-load copper T, where the amount of copper is relatively high. So in copper T, it is usually the device is available in copper 200 and copper 250, while in multi-load copper T, the copper is available in copper 375 and copper 380. So in copper T, the amount of copper is less. It is available in the form of copper 200 and copper 250, while in multi-load copper T, it is available in the form of copper 375 plus copper 380. Now it consists of various devices that is made of copper. So that's the reason that the second generation IUCD, it is also called as copper releasing IUCDs. Copper releasing IUCDs. Now in third generation IUCDs, it consists of the progesterone, and it consists of levonorgestrel 20. So and third generation IUCD consists of progesterone and levonorgestrel 20. Now this third generation IUCD, it is also called as hormones releasing IUCDs. Hormones releasing IUCDs. Now I repeat, the types of IUCDs divided into non-medicated IUCD, medicated IUCD. Non-medicated IUCD consists of first generation IUCD, the famous example under it, that is Libus loop, while the medicated IUCD consists of second generation IUCD plus third generation IUCD. The second generation IUCD, it is also called copper releasing IUCDs. It consists of copper T, copper Nova, multi-load copper T, while third generation IUCDs, it consists of progesterone plus levonorgestrel 20, and it is also called as hormone releasing IUCD. So this is all about the non-medicated and medicated IUCD generations in the form of first generation, second and third. Now what are the main mechanism of action of each IUCD? Now let's more focusing toward the mechanism of action of each class of IUCD. Now if I talk about the mechanism of action more specifically by first generation IUCD, so what is the main mechanism of action of the first generation IUCD, that how it prevent pregnancy? So actually the first generation IUCD, what it do, actually it promote the phagocytic cells, it promote the phagocytic cells of uterus in order to phagocytize, or we can say kill, in order to kill the sperm. So what is the main mechanism of action of first generation IUCD? It promotes the phagocytic cells of uterus in order to kill the sperm. So if sperm is killed, so it is unable to move into the region of fertilization site into the fallopian tube. So ultimately there will be no pregnancy. So it is the mechanism of action of first generation. While if we talk about second generation IUCD, so what is the mechanism of action of second generation IUCD? Now actually these second generation IUCDs, it release the copper ions, and in turn it suppress the sperm motility and inhibit fertilizing capacity of sperm. So what is the main mechanism of action of second generation IUCD? These IUCDs devices, it release the copper ions. Now it release the copper ions, and when it release the copper ions, it suppress the sperm motility. If it suppress the sperm motility, it means the sperm is unable to move into the region of fallopian tube where there is a site of fertilization in ampulla. So if sperm is unable to move, it means there will be no fertilization with egg, so ultimately there will be no pregnancy, and it also inhibits the fertilizing capacity of the sperm. So if it inhibits the fertilizing capacity of sperm, so it will lead to, so there will be no pregnancy. So it is the mechanism of action of the second generation IUCD. Now coming to the third generation IUCD, what is the mechanism of action for that? Now the first generation and second generation IUCD, it is more associated with the sperm inhibition, but the third generation IUCD, it is not acting upon the sperm, while the former and the first and two, they are more act on the sperm, while third generation IUCD, it act a bit different. Like these third generation IUCDs, what it do basically? Now these third generation IUCD, it make the uterus unsuitable for implantation. That often lead to the endometrial atrophy as well. So the third generation IUCD, it make the uterus unsuitable for implantation. So there will be no implantation. If there is no implantation, it means there will be no pregnancy. So if there is no implantation of fertilized ovum at the area of uterus, so what happens that there will be endometrial atrophy occur. The second point is it alters the cervical mucosa. It alters the cervical mucosa. Now if it alters the cervical mucosa, so the sperm is unable to enter. So it also alter the cervical mucosa. So if there is alteration occur in cervical mucosa, so the sperm is unable to enter properly, so the sperm cannot reach to the site of fallopian tube. So ultimately there will be no pregnancy. So I'll repeat, what is the action, what is the main mechanism of action of first generation? It promotes the phagocytic cell of uterus and phagocytize the sperm. The second generation IUCD, it releases the copper ions that suppress the sperm motility and also inhibit the fertilizing capacity of sperm. While third generation IUCD, it makes uterus unsuitable for implantation. So this is all what we need to know about the intrauterine contraceptive devices. So now let's discuss the third type of temporary method of contraception, and that is called as a hormonal method of contraception. And as I told you earlier, the most common type of temporary method of contraception, that is a hormonal method. Out of hormonal method, the oral contraceptive pill, it is more common. Now let's talk about the hormonal method of contraception. Now it is the most common type. Now the hormonal method, it is divided into two types. That is oral contraceptive pills which is also stand by OCPs, and there is depot preparation. So depot preparation further divided into two types, that is injectable method and subcutaneous method. So the depot preparation divided into injectable methods and subcutaneous methods. So in injectable methods, there are two types of in it, that is DAMPA and NET-N. That is depot medroxyprogesterone acetate, and that is norethiosterone enanthate. While in subcutaneous method, it consists of, it includes the implants. Now coming toward the oral contraceptive pills. So the oral contraceptive pill, it is the most common type of contraception. It is the most common type of temporary method of contraception, and the most important and advantage of this oral contraceptive pills is that it prevents the pregnancy by only taking OCPs in the form of tablets. So usually the patient and female, it is use these OCPs in the form of tablets, and that's the reason that it maintain the privacy of the female as well. But actually how this oral contraceptive pills act, so how it act. So basically the OCP, the first part is that it actually inhibits the ovulation. It inhibits the ovulation. So it is the first mechanism of action, that it inhibits the ovulation. Also it inhibits the motility and secretory activity of oviduct. Another is that it makes uterus unsuitable for implantation. It makes uterus unsuitable for implantation. Also, it can act by alteration in cervical mucosa. So, if there is alteration occur in cervical mucosa, so the sperm is unable to enter properly. So how it act? By inhibition of ovulation. It also inhibits the motility and secretory activity of oviduct. It makes uterus unsuitable for implantation, and it also helps in the alteration in cervical mucosa so that the sperm is unable to enter properly. So this is how actually oral contraceptive pills act. Now let's know about the types of oral contraceptive pills. Now what are the types of oral contraceptive pills? Now the first type of oral contraceptive pills, this is called as mini pills. This is called as mini pills. Now mini pills, actually it consists of only progesterone, only synthetic progesterone, and that's the reason that it is also called as only progesterone pills. And what is the famous example under mini pills? That is a Saheli, which is a non-steroidal pill. That is a non-steroidal pill, and actually it is taken once in, and it is taken once in a week. It is taken once in a week. So that's the reason that it is also called as once a week pills. So the mini pills, which is also called only progesterone pills, it is also called as once a week pills. The second example, the second type of oral contraceptive pills is that is called as contraceptive pills, or which is also called as combined pills. And why it is so called as combined pills? The reason is that it consists of synthetic estrogen plus progesterone. So it consists of synthetic estrogen and progesterone. The famous examples under the combined pills, that is Mala N and Mala D. They were commonly used before, but nowadays they are basically banned. The reason is, even though it is so much cheap, but because of their certain side effects, they are not nowadays used. And it is 21 days regularly used. It is being used 21 days regularly in a month. So the combined pill consists of synthetic estrogen plus progesterone. The famous examples under combined pills, that is Mala N and Mala D. What is the third type of oral contraceptive pills? The third type of oral contraceptive pills, that is called as male pills. That is called as male pills. So under male pills, the famous examples under male pills, it consists of Gosipol, that is made from cotton seeds. So under the male pills, the famous example is Gosipol, which is made from cotton seeds, and actually it prevents the spermatogenesis. It prevents the spermatogenesis. But nowadays the male pills, it is being not used and it is banned. The reason is that it is often lead to the azoospermia. So the male pills consist of Gosipol, that is made from cotton seeds, and it prevents the spermatogenesis, but nowadays it is banned. The reason is that it could lead to the azoospermia. Now the another important question is, which sort of chemical is used in the male pills? So the chemical that is used in male pills, now the chemical used in the male pills, that is only progesterone. So this is very important, that if there is a question that which sort of chemical used in male pill, so that will be only progesterone. Now the another type of oral contraceptive pills, that is called as postcoital pills, which is also called as morning after pills. So it prevent pregnancy, if taken within 72 hours of coitus. Now I repeat, what are the types of oral contraceptive pills? That is mini pills, which is also called as only progesterone pills. The second type is combined pills. The third is male pills, and the fourth is called as postcoital pills, which is also called as morning after pill. So students, this is all what we know. This is all what we need to know about the types of oral contraceptive pills. That is mini pills, combined pills, male pills, and postcoital pills. Now let's understand the depot preparation. So depot preparation, it is divided into subcategories, that is injectable method and subcutaneous implants. Now here the injectable method, further it consists of two groups, that is DAMPA and NIT-N. Now we will be discussing more about the DAMPA because it is important. So here we will be discussing a bit DAMPA and what are the contraindications and what are the side effects and advantages of DAMPA as well. So now let's discuss the DAMPA. That actually what are the significance of the DAMPA. Now DAMPA stands for the depot medroxyprogesterone acetate, while NIT-N stands for the ethisterone enanthate. So injectable methods, it consists of two groups. Further it consists of DAMPA and NIT-N. So DAMPA stands for the depot medroxyprogesterone acetate, while NIT-N stands for the norethistérone enanthate. Now DAMPA, it is given in a dose of 150 mg IM, while NIT-N, it is given in a dose of 200 mg IM. Now actually the DAMPA, it is the injection is repeated after 3 months, while in NIT the injection is repeated in 2 months. So this is important. The DAMPA stands for the deportment-deoxyprogesterone acetate. It is given in a dose of 150 mg intramuscularly, while NIT-N stands for the norethistérone, and in that it is given in a dose of 200 mg intramuscularly, while DAMPA, it is this injection, it is repeated after every 3 months, while NIT-N, it is repeated in the 2 months. Now, what are actually the contraindications of DAMPA? So, what are the contraindications of DAMPA? So, the contraindications are if there is pregnant woman and if there is cardiovascular disease, if there is any cardiovascular pathology or disease, if there is liver disease, even if there is strokes, if lady is diabetes, and if there is history of vaginal discharge, and if there is high BP, like more than 160 by 100 mmg. So what are there are a lot of contraindications of DAMPA, but the main are, it is contraindicated in pregnant women and cardiovascular disease, liver disease, if there is stroke, if there is diabetes, and if there is history of vaginal discharge, and if there is a high BP. Now, what are the side effects of the DAMPA? What are the side effects of DAMPA? So, DAMPA can lead to weight gain. So the main side effect is weight gain. So you might be thinking if there is increased bulkness, so you can think a bit of cardiovascular pathology. So the main side effect is because of weight gain, it is more associated with other diseases as well. So the main, even it is documented that in 40% cases, the side effects that is reported, that is a cardiovascular diseases. So even in 40% cases, the side effects that is noted of DAMPA, that is on cardiovascular diseases. So there is weight gain, there is cardiovascular diseases, also there is hypertension, there is irregular menstruation, and there is breast tenderness, there is abdominal bloating, there is mood swings, and there is decreased milk production. So these are the side effects of DAMPA, that is weight gain, cardiovascular diseases, hypertension, irregular menses, breast tenderness, abdominal bloating, mood swing, and decreased milk production. Now also the DAMPA has a few advantages as well. So what are those advantages? Now the first one is that it maintains the privacy of the female. The first one is that it maintains the privacy of female. Now it also reduces the menstrual pain and spasm. And the most important is that it also decreases risk of ovarian carcinoma plus endometrial carcinoma. So these are the main advantages of a DAMPA, that it maintains the privacy of female, it reduces the menstrual pain plus spasm, it also reduces the risk of ovarian plus endometrial carcinoma. So students, this is all what we need to know about the hormonal contraceptive. In a hormonal contraceptive, we discuss all types of hormonal contraceptive, and then we discuss the DAMPA, contraindication, their side effects and advantages. Now let's discuss the fourth type of temporary method of contraception, and that is called as a natural method of contraception. So in temporary method of contraception, it is divided into barrier method, intrauterine contraceptive devices, hormonal methods and natural methods. Now here we will be discussing the we will be discussing the natural methods of contraception. So the natural methods, it means here there is no artificial devices used in order to prevent pregnancy. So here the natural method, it is divided into three subcategories, and that is the first one is, yes, that is called as periodic abstinence. The first one is periodic abstinence, and the another is withdrawal method. And the third is during lactational period. Now, what are the natural methods of contraception? Periodic abstinence, withdrawal method, and lactational period. So coming toward the periodic abstinence. Now, as you know that menstrual cycle repeat in 28 days. Let's suppose this is the first day, and this is at 28 days. So at the mid of the menstrual cycle, at 14 day, as you know that at 14 day there is ovulation. Now, as you know that before ovulation there is pre-ovulatory phase, after ovulation there is post-ovulatory phase. Now at ovulation at 14 day, what happens? It is actually the release of ovum occur from the follicles of the ovary, where it reach to the ampulla of the fallopian tubes, and they stay for the sperm for the fertilization. Now this 14 day, it is considered as a high fertile phase. This is a high fertile phase. So that's the reason the couple should avoid the coitus between the days of 10 to 14. So couple should avoid coitus at the mid of the cycle. This is what we call as periodic abstinence. While on the other hand, withdrawal means to taken out. So as you know that penis is the copulatory organ in the male, while vagina is the organ that collects sperms. Now, as you know that at the time of coitus, the male has a capability when one is about to ejaculate. So at the time of ejaculation, when male expel the penis from vagina and ultimately release the sperm outside from the female body, so thus it is also the one of the way to protect from the pregnancy. So but it is still a risky case. Even 20% it is not possible, while 80% it is more lead to the risk. So that's why a 20% case it is possible, but a 80% case it is impossible. While another hand, lactation period mean during breastfeeding, it is also considered as one of the natural method of contraception. So students, this is all what we need to know about the temporary method of contraception. Now let's talk about the permanent method of contraception. Now the permanent method of contraception, which is also called as sterilization. So it is divided into two forms. Like in females, what are the permanent methods of contraception? That is traditional tubectomy, and that is mini lap operation, and colpotomy, and laparoscopic sterilization. While in male, there is vasectomy. So vasectomy is the permanent method of contraception in the male. So in traditional tubectomy, what happens? We prevent pregnancy by removing and ligation of the fallopian tube of the female. Like as you know that the female reproductive system consists of various parts. As you know that this is the uterus, this is cervix and vagina, this is oviduct, which is also called as fallopian tube. So what happens in traditional tubectomy, we remove the fallopian tube and ligate those portion of the fallopian tube. But this traditional tubectomy, it is done under the mini laparoscopy or laparoscopy, which consists of 2 holes and another is consists of 2 or 3 to 4 holes something. So in traditional tubectomy, we remove and ligate the fallopian tube, while in vasectomy we actually cut the vas deferens and ligate those part of the vas deferens. Like say if this is a, let's suppose if this is a scrotum. Now in the scrotum there are testes and these are vas deferens. Now what happens in the vasectomy, we cut the vas deferens and ligate those portion of the vas deferens. Let's suppose this is vas deferens, so we cut it, we cut those area and the cut portion is then ligated its ends. So this is called as vasectomy, and this cutting should be around about on 1 centimeter. The incision is on 1 centimeter, and the another is when it cut the ligated, when we ligate this portion, so the sperm is unable to enter into the urethra. So this is a vasectomy, and actually we can do semen analysis after 3 to 4 months of the vasectomy as well. Now this vasectomy can be performed by 2 methods. This vasectomy can be done by 2 methods, that is a open-ended vasectomy and non-scalpel vasectomy. It is done by open-end vasectomy and non-scalpel vasectomy. So what are the post-procedure care for the permanent method of contraception? That is, the patient should avoid the heavy physical activity for at least 15 days and should apply the T bandages for 15 days as well. So students, this is all about just overview of the temporary methods of contraception and permanent method of contraception. So this is all about the contraception. So students, if you have any query, please put your question in comment section below. I'll definitely try to answer. Thank you so much.